I'm Mark Hallett. I'm the president of the Functional Neurological Disorder Society and the chief of the Human Motor Control Section in FNDS, NIH, Bethesda, Maryland. I want to make clear that the opinions that I express here are my personal opinions and not the official position of NIH or actually of FNDS either. I am going to discuss my view of what the proper terminology should be for seizures within the general category of functional neurological disorders. So the terminology in this area has been very difficult. A large number of terms have been used over the years for these disorders, and that would include hysteria, medically unexplained symptom, conversion disorder, psychosomatic disorder, pseudo-seizure, psychogenic non-epileptic seizure or attack, or various combination of these terms, dissociative seizure, and functional seizure. This has rendered the situation relatively confusing, and I think it's better to have one term for physicians and one term in the same term for patients so that everybody understands what's going on. Now, in terms of a definition of what we're talking about, functional neurological disorders can be defined as a neurological disorder characterized by almost any type of neurological symptom caused by a brain network dysfunction. And that's the important term here. It does not exclude the possibility of normal function, sometimes due in part to a psychological cause and not explained by other neurological pathology that may or may not be present. Symptoms may be inconsistent or incompatible with other known neurological disorders, human anatomy, or physiology. My personal definition at the moment. The critical element here is dysfunction. We understand that the brain is not working properly in causing these particular problems. Now, there are many neurological disorders, as that definition deals with. Seizures are probably the most common, in fact. Movement disorders, second most common, and they would include all types of movement disorders, as indicated here. Weakness, sensory loss, somatosensory and visual area, dizziness, speech disorders, memory and cognitive problems. And in fact, many of these are overlapping with each other, some patients having more than one of these problems. And in relation to seizures, for example, such a patient with a paroxysmal tremor or paroxysmal dystonia may wind up either with a movement disorder doctor or an epileptologist. So that there are many overlaps with these entities. Now, movement disorders are now generally called functional movement disorders, weakness, functional weakness, sensory loss, functional sensory loss. Dizziness is getting toward functional dizziness. It's not quite there yet. Speech disorders, functional speech disorder. Memory and cognitive problems, functional cognitive disorder. And what should we call seizures? I'd like to deal with this question first. Why are functional neurological disorders put together? There is common epidemiology, sharing of clinical features and overlaps, as I already pointed out, common etiological factors, common pathophysiology, and common treatment approaches to these disorders. And given that there is so much commonality and overlaps, I believe that they should have common names. Now, in the movement disorder area itself, movement disorders were called psychogenic movement disorders up until about 5 or 6 years ago, when there was the battle of 2014. There was already the idea that the name should change from psychogenic to functional, but it was a series of papers in that year that turned the tide. So the first in that regard was this paper by Edward Stone and Lang it's time to change the name. And this precipitated a number of other papers that came along in succession. Psychogenic movement disorders, they are what they are. Functional or psychogenic, what's the better name? Comment on psychogenic versus functional movement disorders. Psychogenic versus functional movement disorders, that's the question. And then back to Edwards, Stone, and Lang, functional psychogenic movement disorders, do we know what they are? And it was really after this series of papers that people really read them and decided that functional was really a better word than psychogenic to talk about what we are dealing with. And so I think that we should choose functional seizure out of this list. I think that it will make clear that functional seizure belong to this same category and will simplify the situation and make things clear to everyone. So that's my view, and I look forward to hearing others, and I hope that I've convinced you.